Hospitals and clinics across Texas are seeing a surge in patients amid an increase in cases of flu, COVID, and RSV. The Tripledemic is just the latest such surge that's putting pressure on healthcare workers. It's highlighting concern about the ongoing difficulties in finding enough doctors, nurses, and other healthcare professionals to meet the demand. Monica Madden looks into the problem as well as some proposed solutions that lawmakers could consider in the coming session.
It was pretty miserable.
2 RSV diagnoses for Fort Worth mother Kirsten Openshaw's sons was bad enough.
They did so good.
Tough watching them struggle.
Baby Quentin was born prematurely, and 4-year-old Lincoln has a heart defect. So getting treatment fast was critical.
We had quite a few sleepless nights where he was just having a real hard time breathing, keeping them inclined, doing a lot of breathing treatments, that kind of thing.
She didn't expect not being able to get either of them a doctor's appointment when they got sick.
We really only take them in if it's really bad.
Her pediatrician's office told them to go to the emergency room. Openshaw ended up driving an hour to get her boys into a rural doctor.
We didn't really feel like we had a lot of options as far as where to take them.
The virus surges combined with overall staffing shortages, leading to similar scenarios for Texans across the state.
Emergency rooms have been inundated, children's hospitals as well as adult. They've seen double their usual daily number. And that's, you're never staffed to gear up that much.
It's why lawmakers like Representative Donna Howard, a nurse, are honing in on broader staffing solutions.
We've got to do more to invest in the workforce pipeline with education, reimbursement, tuition assistance, getting faculty in place.
Without enough staff to meet demand, families like Openshaw's will have to brace for waiting.
No doubt that if we hadn't gotten an appointment, his situation would have been bad.
For parents who might not be able to get their child into a pediatrician, healthcare professionals recommend trying to get a telehealth appointment first before going to the ER. Josh?
Monica, this is just the latest surge in patients straining healthcare workers around the state. Lawmakers are less than a month away from the next session. What are some of the ideas coming at the Capitol to help with the ongoing staffing crunch?
We've already seen a number of bills pre-filed, including Representative Howard. She filed a bill that would target violence against healthcare workers. It's always existed, but definitely was exacerbated by the pandemic. So her bill would set up mechanisms for reporting that violence, provide security and treatment if necessary. Now, while that doesn't exactly target workforce issues directly, those types of threats certainly don't help with staff retention. So she's hoping it'll help with that. And another bill filed by Senator Lois Kolkhorst would expand support for college and university level nursing education. Things like loan repayment assistance and grants to nursing programs. So that bill directly aims at improving the pipeline from school to the workforce. Josh?
All right, Monica, thank you very much.
Thanks for having me.
The deadly winter storm fueled calls to redesign the electricity market in Texas. Now there are new questions about the plan, how the people in charge are responding to the concerns. He may have the most power of anyone at the Capitol, but will that be enough to push Dan Patrick's priorities through?
I can have initiatives and priorities, but I need the votes in the Senate to bring them to the floor and pass them to the House.
We go one-on-one with the Lieutenant Governor, how his ideas will shape what becomes law in Texas.